Good morning, Vega. Good morning, Melissa.
Good morning.
Hello? Hi, is that Melissa?
Yes, ma'am.
Hi, Melissa. How are you?
Good. How are you?
I'm doing well. Thanks for asking. Melissa, I just sent you an email a few moments ago in reference to the minutes for the meeting in January. I didn't receive those from Jonathan. He usually sends them, but I didn't get them for January.
I did see them. I think let me do some research. I'm wondering if maybe I got the draft version and maybe he didn't send out the full. Give me one moment.
Okay, thank you.
Vega, I do have the minutes. I think they were not sent to the full performance management committee, but I will go ahead and forward that over right now so that I have them for review.
Thank you so much.
All right, I just sent those over. Please let me know if you don't receive them, and then I can work to get them to you.
All
Thank you
right, I
for
appreciate
your
that.
attention. I appreciate it.
Melissa, did you send that to everyone?
Yes, I did.
Thank you.
Now, I will say the minutes from January is we were still having the issues with Zoom, so we didn't necessarily have recordings to go off of for those minutes. So I know we'd all really appreciate it if you guys can just review and make sure there's nothing inaccurate up there, especially if you are present and you're not listed or something like that.
Okay, Melissa, this is Vega. I did get the email you just sent, so to be clear, we don't necessarily have something for January. It's the December that we're gonna be.
No, we have January minutes, but what we didn't have was the recording, and we didn't get the usual printout or the usual attendance record. So if you could view, especially things like attendance on the January minutes, that would be super helpful because we didn't get that information recorded.
Okay, so Melissa, what you sent me was, it appears as if it's December 14th.
That'll be an edit I have to make. I'm sorry. That is going to be January 11th.
Oh, okay, okay.
I'm
So there is-
sorry.
Okay. I was like,
I'm sorry, everyone.
all righty, thank you.
Hey there, sorry, I was having some technical issues with trying to join. Can you hear me?
Yes,
We hear you.
Okay, all right. Good morning. Hope everyone's doing well.
good morning.
Hold on, I'm working with a couple of screens. Let me switch screens. Hold on. Feel that way. Okay. Has everyone received a copy of the agenda?
Yes.
Okay. Computer has a mind of its own this morning. Still. Okay, all right. Well, we'll go ahead and call the meeting to order. I don't know if we have anyone signed up for public comment period. Are you aware of anyone, Lloyd, who signed up for public comment?
I am not aware of anyone who signed up for public comment. I don't know if Melissa is aware.
We do not.
Okay, all right, great, thank you. So we'll move on to the third item of the agenda, which is the approval of the January minutes. I think those were sent out, Ms. Shanta, Addison.
Melissa just sent them out just now. I do see that I have to make an edit on the date. And then we've asked everyone to just kind of verify the attendance and other things because the meeting wasn't recorded last month.
Okay, all right. Could we move that to the latter part of our meeting then and come back to it to give attendees an opportunity to kind of review it and then vote on that, Lloyd?
Yes, that's fine.
Okay, all right. We'll shift the agenda, that agenda item number 3 to after the number 6 before adjournment. Next agenda item is a presentation discussion on the performance improvement plans, and so I'll yield it to Lloyd.
Tracy, may
Yes,
I ask
ma'am.
a question? We do have some people on the call today that are kind of new faces. Can we get an introduction for them? Because I usually list which agency they're with as well on the agenda.
Sure. Thank you, Shonda, for letting me know. I did see a few names I wasn't as familiar with. I'll start, and I'm not sure where we fall on the screen, so we'll do this. I'll start with my introduction, and then I'll call the next person, and then the next person will call the next person, because you probably all look very different on each of your screens. So I'm Tracy Stone-Dino, excuse me, Tracy Stone-Dino with Alliance Health. I'm the director of housing assistance programs. We cover a managed care organization that covers mental and behavioral health services across 7 counties. And I will call on Lloyd next for introductions.
Thank you. I'm Lloyd Schmeidler, Senior Community Development Department Analyst, Senior Community Development Analyst in the city's Community Development Department. I want to ask, as people introduce themselves as well, as they, I think for the Secretary's sake, acknowledge whether they're a member of the committee or a member of the broader community. I am COC lead agency staff.
Hi, everyone. My name is Amaya. I am actually a UNC social work student and also a resident of Durham. And then I also work for UNC Horizons. So I'm just here to observe and listen. Thank you.
Hi, my name's Adita. I'm also a student at UNC. Right now I'm working at a private practice, interning at a private practice, but I am located in Durham.
Happy Friday Eve. I'm Vega Swepson. I work at Durham Technical Community College.
Hi, I'm Anna. I am also a UNC student, just here to observe. I actually reside in Chapel Hill, though. So.
Good morning, Sally Wilson with Project Access of Durham County.
Good morning. My name is Nicole Lamb. I am the program director for Coordinated Entry, the front door of Durham County, and I am an agency lead.
Good morning, everybody. Apologies, my camera is not on. I am parking my car. I'm Eliza Matthew. I work at Duke in the Office of Durham and Community Affairs. I'm on this committee, and I'm also the current HSAC chair.
Good morning, I'm Shantae Addison. I'm the Director of Client Services at Housing for New Hope, and I am a member on this committee.
Good morning. My name is Angela Holmes. I am a member of HSAC as the County Homeless Representative.
Okay, great. Thank you. Good morning, everyone. Thank you for taking the time to introduce yourselves. As I'm looking at the screen now, I didn't recognize a few of the individuals that have joined us this morning. So thank you for taking the time to introduce yourselves and which organizations you're affiliated with. So the next item on our agenda is going to be presented from Lloyd from the city of Durham in regards to our discussion on the performance improvement plan. So I'll yield to you, Lloyd.
Thank you, Madam Chair. Substitute chair for the committee chair of Jonathan Crooms. Want to do a couple things in this presentation. First of all, review some previous performance improvement plans. The committee has had some good discussions over the last couple months about performance improvement plans relative to any efforts to ask COC funded projects as a result of their performance evaluations to submit a performance improvement plan for the committee's consideration and approval. We haven't had performance improvement plans mandated by the committee since 2019. I'm gonna review 3 that we did, that we asked projects to submit to us back in 2019. I've not submitted these or forwarded copies of these to the committee. Those who were on the committee back in that time period would, I think, have received these. This first one is from Housing for New Hope, and kind of again by way of introductions to these plans. We typically, based on the information that and the areas in the performance evaluation in which projects were seen as weaker, we recommended that the organization and the project staff focus on 2 or 3 areas that could improve overall project performance. So for example, this first one is for Housing for New Hope's Rapid Rehousing 3 project. And it says here in the introduction that it received an overall score of 61.3, which was below the threshold of 65%. Madam Chair, would you confirm that you can see my screen in this performance improvement plan response? Very good. Okay. So Housing for New Hope concentrated on 3 key areas: improving the length of project participation, improving participants' income, and HMIS data integrity. And so each of these 3 areas, you can see that Housing for New Hope indicated some areas as to how they would try to improve performance in those areas. Has time commitments and focusing on how they would begin to track their progress for, in this first case, improving the length of participation, especially focusing in on how quickly clients move from project entry into housing. The second area was looking at improving participant income. This continues to be a strong focus area for HUD, and one of our system performance measures is around improving client overall income. We understand as a community that sustainability of housing is related to efforts to help clients improve income, whether that's through obtaining public benefits or obtaining employment income. The third area for this performance improvement plan focused on improving HMIS data integrity, improving data capture, data entry, and the use of data to evaluate project performance. I don't know if Shante might have any follow-ups around software system complementarity in addition to the HMIS that Housing for New Hope may be using to supplement their data entry work in the HMIS. I'm going to stop sharing of that document and then come back to sharing the next document. And this one, can you see this one? Okay. This one was for this one was for Durham Housing Authority's Home Again project. again, we identified several performance issues and asked VHA to submit a performance improvement plan for those areas. Committee members may recall that the Durham Housing Authority agreed to reallocate the Home Again projects, COC funds, to other projects in the 2022 competition. But prior to that, we had asked them to improve HMIS data quality work, and they implemented this plan of action to do better with data entry work. The second area was serving high need and vulnerable populations. And we indicated that they performed poorly due to, again, to insufficient data entry. And they agreed to restart attending chronically homeless prioritization meetings in June of 2019. And so there's a timeline for how they would do that. And so those were the two areas that this performance improvement plan focused on. The third improvement plan I'll briefly review will be I had pulled up the performance improvement plan of Fresh Start. Madam Chair, can you see this, that performance improvement plan?
No, not yet.
What about now? Still not?
No. Well, now the screens come in. There it is. Okay.
On the right one. One housing for New Home, right? This,
Yes, it's for Housing for New Hope. Is this the one that you showed prior to Durham Housing Authority?
right, I'm trying to get to Urban Ministries. Any progress?
No, not yet.
Now I think I'm the right one. Yes.
Yes. Urban
All right.
Ministries.
So Urban Ministries, this also was from 2019. The three areas we invited them to focus on were employment, income and cash and non-cash benefits, project costs, and the timeliness of data entry. So this plan reviews each of those areas, particularly in terms of workforce development, WFD, working to ensure that their staff were trained on using the HMIS and working to increase data entry into the HMIS regarding employment and income, to help also to help establish income goals for participants. In terms of project costs, this is an ongoing challenge for the Fresh Start project, because while it is a rapid rehousing project, it does focus its target service population are people who have experienced or are experiencing chronic homelessness, but who, because of our limited supply of permanent supportive housing, are not likely to get into a permanent supportive housing placement. So we're using rapid rehousing resources to focus on them. And so housing, they have done better with that over the years, but it continues to be a challenge. They are working also, as indicated here, to encourage participants to consider shared housing or roommate matches, and working to decrease costs. The length of stay also is an acknowledged challenge, kind of relates to the reasonable project costs or exit cost. And so that is, again, with acknowledge that since their target population is chronically homeless people, it takes them longer to reach housing stability than it might for other households whose experiences of homelessness are briefer. The last performance area was the timeliness of data entry. They did not score any of the 25 points related to timeliness on this evaluation. And there was work to develop a plan of action and to do better to improve the timeliness of their data entry work. So those are kind of three performance improvement plans. We've not had a template. We have a potential template if the committee wanted to encourage the use of a template. I have drafted a template that hopefully we can see here. This would be a potential template if the committee wanted to adopt a specific template. So this would have some basic information about the project that could highlight or circle one of the two types of COC funded permanent housing projects that we're funding through COC funds. The name of the organization, the start date, and agreed upon end date. Identify two areas of concern. Again, these likely would be recommended areas of concern based on the performance evaluation that is conducted in the winter or spring of the year. And then for each of those, developing improvement goals similar to what the performance improvement plan samples that we reviewed could be indicated here, a description of the goal, and then specific milestones that would indicate that they are moving towards achieving the goal over time, and then a specific activity description and a start date for implementing those specific activities. Then the performance improvement plan could be signed by the project manager or the overall coordinator for implementing that project, the organization's executive director or chief executive officer and indicate when they both sign that. And then the plan could be reviewed by the Performance Management Committee and approved, and we would name who is the chair of the Performance Management Committee when the Performance Management Committee approved the plan. So that would be a potential template if the committee is interested in adopting a template for performance improvement plan going forward. We do know that the committee and are grateful that the committee approved improving the satisfactory performance threshold to 70%, starting with the second evaluation of 2024. Madam Chair, that is my presentation.
Okay. All right, great. Thank you so much, Lloyd, for not only providing some examples of prior PIPs, but also the format in which we could possibly use moving forward. I see Ms. Renee's hand raised.
Yes, I just have a question. Lord, would we be able to get copies of what you presented as well as this example?
Yeah, we can certainly send these out. I think in fairness to these organizations that submitted these performance improvement plans back in 2019, I'll redact their names, but I will send those out to the committee.
I have a couple of follow-up questions. So with the performance improvement plans that were submitted for those organizations, I know with the Durham Housing Authority, Alliance partnered with them, but they were the lead agency. And I know you all met with us early on to kind of go over areas in which there could be improvements. Did that happen kind of across the board for all the other organizations to kind of identify which areas they performed not as high in to kind of help them craft their PIP?
Yes, we did that with all three organizations.
Okay.
And to clarify,
so that can guide them through that process.
Right. And to clarify as well, we've not asked, or to confirm, we've not asked organizations since 2019 to submit performance improvement plans for a couple of reasons. One was we were in the midst of the pandemic for a number of those years. And secondly, that most organizations were meeting the 65% threshold that had been the standard up until this year.
Okay. And were there I know with the format you're proposing to use moving forward, would there be like benchmarks along, will they have like a year of time to make improvements, and then will there be benchmarks along that way to kind of check in to see whether or not they're on target to meeting that or have met that, to kind of give you an indicator in terms of them improving any of their processes?
The idea of the improvement goals and particularly the action plan would be to include those milestones as to when we would look to have specific activities started and a deadline for accomplishing them. And then there could be potentially follow-up work. We did not do a whole lot of follow-up work with the performance improvement plans in the 2019 period, partly due to staff capacity and partly due to the reality that we are evaluating projects kind of semi-annually, so the committee is able to see specific progress that has been made with the semi-annual evaluations. And I think there's recognition at the lead agency that with improving overall project performance, it can take a good period of months for organizational staff, project staff to focus activities and to make improvements that are really going to be reflected in an annual performance report.
Sure. I just was I was concerned, setting people up for success versus failure, to
Correct.
have some way to see whether or not they were meeting expectations of making improvements. So the semi-annual evaluation will kind of be that benchmark, is what you're saying, that will give you the lead agency, an indication in terms of where if they're going in the right directions in terms of making improvements.
Yes, and also the committee could ask the organization and project to submit, for example, quarterly reports about progress on implementing a performance improvement plan. If we mandated that an organization would be asked to submit not only the performance improvement plan and to have that approved by the performance management committee, but then also submit quarterly reports that could be reviewed by a subcommittee of the performance management committee and or the COC agency. That's certainly a way to enhance accountability for implementing a performance improvement plan. Obviously, a plan only is valuable if it's actually implemented, right?
Yeah. Okay. Yeah, those would be good suggestions to kind of, I don't know. I know it seems like it was thrown out maybe the last meeting before this, when we started discussing the PIP for potential and the threshold for them to potentially maybe do a presentation to our subcommittee. I don't know if it would necessarily be in the format of an actual report, or just simply sharing some updates in terms of their metrics that relate to the evaluation of their project. So that may be another way to kind of supplement what the semi-annual performance evaluation would capture as well.
Correct.
Any other questions or comments? Okay, seeing none, were we prepared to vote on this, or were we still in the review process, Lloyd, of, because I know we wanted to see examples and you presented those, and I think that was really good to kind of see how that was laid out from each of the different organizations, because it was a combination of permanent supportive housing as well as rapid rehousing projects, correct?
Correct. The DHA's project was permanent supportive housing, Fresh Start, and Rapid Rehousing 3 were both rapid rehousing projects.
Okay, and so that kind of gave us that did give us an example of what that appears to look like in terms of a format, and the other form that you presented would also give some uniform context to each organization, kind of laying it out in terms of what areas that needed to be improved and what goals and milestones would be cited to make those necessary corrections. So I'm not sure at this point, were we to vote on this today, or were we simply still in discussion mode?
I think we're recommending that it be discussed today and potentially approved if the committee, sounds like the committee would like to approve a template for performance improvement plans, and I think it's fine to discuss it today, and since it was just presented to the committee today, to potentially approve it at the March meeting.
At the March meeting, our next meeting.
Right, and if there's
Okay.
any suggestion for improving the template, please feel free to send me an email or your suggestions.
Okay, All right. Well, that's where we will stand with that, given the recommendations from Lloyd as we, so you will share copies of the performance, improvement plans with redacted information, and then the actual form that you develop for us to kind of see what that format will look like. So we can
Correct.
have that in preparation for the next meeting to
Yes.
vote on it.
And more than likely, I'll be getting that out to you by the end of the week.
Okay. All right. Thank you.
Those who are guests, I know there's several students, you want to be included in receiving this information, please post your email address in the chat so we can be sure to have those available.
Okay. All right. Thank you, Lloyd. The next presentation you will be sharing with us is an update on the 2024 Housing First evaluation process.
Thank you. A number of you are participating in the Housing First evaluation process. That process is beginning. We've had trainings with the HSAC members and other volunteers from within the COC that are involved in conducting the Housing First evaluations. We have 3-person teams identified for the 6 evaluations that we are doing. Each of the evaluation teams, one of the team members will be a member of the homeless team here in the Community Development Department. Those have been assigned. Information has been shared with the team leads and the teams as to their assignments, and they have been in communication with each other and are in the process of making contact with the organization and the identified staff members at those organizations for arranging for a site visit. The policies and procedures of the various projects have been shared with the teams and the team members and the team leads. The process, the next step is going to be to have essentially an organizational meeting with the 3-member evaluation team to get organized for a site visit, as well as to do initial review of policies and procedures. We're recommending that the teams try to conduct site visits with the projects by the end of February or early March at the latest, and then finalize the overall Housing First evaluation with their team by the end of March, so that we can get those Housing First evaluations distributed to the projects themselves for their follow-up work, as well as the COC agency. And we not talked about, forgive me, I'm trying to get my overhead light up back on. There it goes. It invariably goes off when I'm in meetings. So that process is underway. I think it's going well. Grateful for the participation of a number of HSAC members. Those of you who like Tracy or Shantae that are working in an organization that has a project being evaluated are not participating on an evaluation team to avoid those kind of conflicts of interest. But Eliza and others on the HSAC and other committee members are participating. And again, we've got a combination. I think there's 9 HSAC members, and that's supplemented by 3 other community members. A number of the other community members are, a couple of them are people with lived experience of homelessness. And then, as I mentioned, the 6 members of our community development homelessness team are each participating on a evaluation team as well. So that's kind of where we are with that. Happy to respond to any questions.
Lloyd, you mentioned that the reports will be finalized by the end of March to distribute to the agencies. Will there be any other, context in terms of presenting this to HSAC or sharing this information in terms of the findings of the Housing First evaluation with the larger committee, HSAC, or anything related to that?
We've not made any firm decisions about that. Let me discuss that further with Colin, our manager, and see what recommendations we may want to make to the committee about that question, and we'll come back to you with a recommendation about that in March.
Okay. All right. I just thought I'd ask. Also, it wasn't on our agenda, but I'm going to do a quick ask. It's kind of related to Housing First. How did the PIT count go in January?
I was actually ill, so
Oh no.
cannot say a whole lot about how it went. I know Shantae was heavily involved with organizing for it and training volunteers, etc. So I would defer to any comments that Shantae may want to make on that question.
Okay.
Lloyd, you were missed. You were missed very much. It went well. We had upwards of 120 volunteers
Oh, that's great.
that participated. I think the count, I have not checked the command center. I have had to decompress from PIT for a little bit. So I usually wait to check to see how many surveys we've gotten, but I know it was well over 120 surveys. I'm thinking in the 140s the last time I checked of unsheltered or observation surveys. So as a community, we've got work to do still. We're not out of jobs yet. But overall, it went really well. We had officers this year to accompany. We also had members of the HEART program to accompany our teams. I think it went really well, and I'm excited. We had commissioners, the mayor speak. So it was a really big event.
Okay, great, great. I'm glad it went well. So I'm sure we'll more information and data will be shared in terms of the count in terms of, because this is kind of a snapshot of homelessness in one point in time, captured in at one night. And so sometimes it kind of tries to capture all of those at that night, but it gives us a glimpse into that number, but it always doesn't necessarily say that's the entire or aggregate number of people that are experiencing homelessness within Durham. So
right, and it was a relatively warm night, so a lot of the
okay.
sites were empty, which was okay because we do service-based counts after that evening. So we did 3 or 4 service-based counts post the actual night of PIT. We did a youth count. We did a count for families where they could drive up in cars. And we did some mealtime service-based programs as well. So, and then, the information should be out by April about,
Okay.
what this actually resulted in.
Okay. Great. Thank you for sharing that, Sean. I saw Miss Renee's name up, and then Lloyd's hand up, and then Jeffrey's hand up. So we'll start with Miss Renee.
Hi, Shantae, I really enjoyed being out, but I had a question. We had noted a couple of people that we wanted to see follow-up on. Do you have an idea of how that takes place?
So we keep the sheets that we give each team. We keep those sheets and we review those sheets. And after the actual point in time count is completed, which it was complete on January 31st, they go back out. Our street outreach team goes back out and they make contact with those particular individuals or families that requested follow-up.
Okay, we just had a couple concerns that arose from the team, and I was just wondering how they were handled. I guess that will be included in the report, like a listing of the number of follow-ups for different types of requests. Is that how it works?
I think Lloyd can probably better answer that, what's in the report, but I don't think that
Okay.
type of information is usually in the report. But what our street outreach team is, they go back and revisit those sites, especially the sites where we know are active. Because we had a number of sites where it actively looked like somebody was sleeping there, but they were not present at the time. So they'll go back out and reach those sites, especially to make sure they were counted and make sure their needs are met.
Okay, great.
Okay, thank you. Because I'm wondering, do they have to go through the coordinated intake or entry process, or are they listed on the prioritization running list that we have for the COC? Do you know, Lloyd, whether or not that's the case?
I'm going to defer that question to Jeffrey, our coordinator.
Okay, and I
administrator in
see
our
your
office.
hand, Jeffrey.
I apologize. Can you repeat the question for me? I was trying to type at the same time.
No, I was saying, given like the example that Ms. Renee gave around the individuals that were a couple of families or individuals they were concerned about, do you all kind of help them route them through the coordinated intake or entry process, or do they become a part of the prioritization running list of individuals that we're trying to assist with housing?
So I
Or is
think
that
what you're
coordinating between
asking,
Housing for New Hope and the city?
I think what you're asking, I can help answer some. So sometimes if you can either go through street outreach as a way to engage in the continuum of care system, and you can go through entry point as a way to engage the continuum of care system. If we engage someone on the street outreach side and they're not yet ready to enroll in programs or services, we still enroll them in HMIS. They may not give us a name. It may just be corner of Roxborough and Club Boulevard or something that we put in HMIS. And then once they're ready to actually engage in services, because they don't have to, they're not required to, they're not yet on the by name list when they are just enrolled in HMIS. They don't automatically go on a by name list at enrollment in HMIS. They have to be enrolled in a program to be, and correct me if I'm wrong, Jeffrey, but they have to be enrolled in a program to be on the by name list or some type of entry, because if they're not yet ready to participate and go through those housing services, they're not, they don't have to be, and that's okay. But we will still go out and give them basic needs if they need basic hygiene things, or we'll just go out and check on them. For example, we had a client who they've engaged for a year and wasn't ready to commit to any type of program services. And there was a death investigation at a nearby campsite, and our staff was really concerned that it may have been this client. So they went out and checked, and he felt so supported that he finally engaged with services. So at that point, he decided to enroll in some type of street outreach program service. So that goes into our UCA or our state ESG street outreach projects.
Right. So to make that clear, there's two projects at Housing for New Hope. One is just case management, which we don't count when we're doing the by name list. The other is street outreach, which we do count. So they can be engaged, just like Shantae said. She did a wonderful job explaining that there's two separate projects in HMIS. So are they in HMIS if they get the case management? Yes. Are they on the by name list if they're in case management? No. They would need to be enrolled in street outreach. So we're still tracking, we're still attending to their needs, because just as we feel that housing is a right, to be unhoused is also a right if that's what you choose. And if you don't want to engage in this services to get you permanent placement, then we would still try to attend to your needs in the case management project.
Okay. All right. Thank you for clarifying that, you both. Ms. Renee, I see your hand up.
Just one follow-up question. The one example that we had, the couple was interested. They wanted support in getting a home. The young lady had mentioned that she was working with or wanted to work with Alliance Health, In another instance, it was a mental health issue. So it sounds like the street outreach group would have followed up on those cases and put them on in one of two categories. Is that correct? Am I getting it right?
Sorry, I've been trying to unmute.
I'm sorry.
Yes, it's
That is
yes, it
correct.
is.
But I will say that the population is also very transient, so they could have been new there that night. There's no telling. But our street outreach team does go back and look at those sheets and make sure they re-engage with those particular folks. Hopefully they'll still be there when they go back out to engage with those folks. Make sure that they are enrolled in services. And sometimes people don't understand what services they may already be enrolled in, especially if they're connected to multiple services or other things that they have going on. So they do go back out, and I'm sure because I gave the sheets back to our street in the night. I'm sure that they will be connected if they can be found.
Okay. All right. Ms. Lloyd, I see your hand.
Yeah, thank you. I wanted to come back to the point in time count itself. One of my responsibilities is to finalize our unsheltered count numbers, and to follow up to Shantae's earlier comments. I checked earlier in the week, and through January 31st, we had like 157 surveys completed in the Counting Us mobile app that we have been using now for a number of years for the count, and the app seems to work pretty well. Of that number, about I think 75 were observation only surveys. So, and one of the challenges there is to confirm whether the volunteer who entered the observation only survey actually saw a person that they believed to be homeless, or whether the observation only survey would have been just for potentially a tent or an encampment of some kind, where there was no clear evidence that there was actually at that time a person there. And so a lot of the work that I'll be doing over the next week or two is with Rebecca Bourgeois at Housing for New Hope Street Outreach team to sort through and work through the individual surveys, particularly the observation only surveys, to confirm which of those surveys should be included as a final count of a unsheltered person for the night of January 24th. We'll also be looking at the street outreach caseload to confirm whether some of those individuals that might be on the caseload but were not encountered on the night of January 24th should nevertheless be included in our final unsheltered count. So we've still got some work to do to finalize that count, and as Shantae mentioned, we'll be presenting the final numbers to the HSAC and to HUD by the end of April.
Okay. All right. Thank you. I thought I just asked for follow-up, and I appreciate you all sharing more information, because we do have new people that have joined us today, and it kind of helps us to learn more about not only the process itself, but also how people actually are prioritized in terms of their homelessness. And thank you, Shante and Jeffrey and Lloyd as well, for just reminding us, housing is a right, but also homelessness sometimes is a choice and a right as well if they do not choose to be sheltered. And so I appreciate you all sharing that information with us and the group as a whole. Next item on our agenda is the update on the spring 2024 semi-annual performance evaluation. And I'm going to yield to Lloyd again to Jeffrey had his hand up. I'll go to Jeffrey and then to Lloyd to present that information. Yes.
I just do have a kind of peripheral question about the pit count itself, and just a little more clarity. I understood the some of the participants involved, but also that the police were involved. Can I get some information as to the rationale behind that, of involving the police in the pit count? There's a lot of statistics nationwide that kind of go both ways. I was actually, while we're talking, when I tell you I was typing, I was looking at some HUD guidance, and there's some information about it, about involving the police, how it can decrease a count because of distrust. And that is, there's information both ways, because they're saying there's some benefit if there's a trusted police force. You're in a region where the police force is very trusted and there's been no issues. But in areas where there have been issues, there is substantial data that shows that the pit count is greatly decreased because people would disappear if they know that the police are going to be involved with the pit count. So I just want some neither for or against, but just some data as to the inclusion of them and the rationale behind it.
Yeah, I can take that question, Jeffrey. We have had good relationships with the Durham Police Department, especially over a number of years, and they have, especially crisis intervention team officers, have been closely involved with a variety of outreach services, many times to people experiencing unsheltered homelessness throughout the Durham community. And during the point in time count itself, over the years when they have been present for the count, they have been focused on providing security and an additional measure of safety for the volunteers. Generally, if they are encountering, if the team encounters individuals who are unsheltered, the community volunteers are the ones who will take the lead in interviewing the unsheltered people, and the police officers who may be accompanying the team hang back and are not, they're not involved with interviewing unsheltered people. They're simply an additional layer of security to ensure the personal safety of the volunteers. It's just they're not, so they're kind of a security escort for the volunteers, but they're not people who are actually interviewing people who are unsheltered.
I was more so referring, thank you, Lord. I was more so referring to trust between the homeless and the police, not the volunteers. I'm more so referring to the comfort level of people who are experiencing homelessness. And I'm thinking about the optic. Again, I didn't do the pit count in Durham. I live in Raleigh, full disclosure, and it wasn't done that way here, and I haven't done it that way in the past. We used to do it and then stopped because of the level of distrust between the homeless population and the police, and the optic of it, where you have volunteers that you trust, but then an officer that comes along as well, and the issue with encampments being disassembled, with making camps known to the police, and then having camps being kind of a hot button topic right now. So I'm more so talking about the trust from that side, from the population that is experiencing, because the pit count, although we're conducting the count is more so for the people experiencing homelessness than it is for the volunteers. It's so I can get an accurate count of them, not the volunteers. So I'm more so asking about their involvement from that side.
Well, I mean, I think you're getting into a little bit of a policy question, and the Policy and Planning Committee has, for a number of years since we organized Performance Management Committee and Policy and Planning as committees of the Durham Continuum of Care through the governance charter that was approved by the COC back in 2018 or 2019. Policy and Planning is responsible for approving the annual plan for conducting the point in time count of unsheltered people. Again, I think we can certainly bring this concern to the lived experience work group of people with recent lived experience of homelessness that our colleague Anthony Henderson is coordinating for future. But we, again, many of the crisis intervention team officers on the Durham Police Department have good relationships with many of the unsheltered people that are known in the Durham community. They participate with unsheltered the monthly kind of a virtual meeting of the monthly unsheltered work group that has been meeting since the pandemic started, that continues to meet to provide outreach and services to unsheltered people in the Durham community. So I don't, we have been very careful in Durham. I don't know the experience in Raleigh, but I would say the Durham community has been very careful over the last several years of avoiding situations where there's any sense that law enforcement is focused on removing encampments or try to work closely between the Unsheltered Coordinating Agency, which is Housing for New Hope, and various city departments and county departments as well as may be needed to avoid situations where people might sense that there's any efforts to criminalize unsheltered homelessness. That is not and has not been Durham's approach.
I guess this is probably not the right venue for it, so we can take another place. But I was just kind of questioning it because I look at the count that we have at what street outreach shows of their count of that they conduct and what's on the by name list, and then the preliminary numbers from the pit count are far less than what we know to be the homeless population. And street outreach does an amazing job with getting out and keeping up with it, and their numbers are much higher than what the pit count shows. So I guess in debriefing and when we get into the other committee, I think it may be something that we want to look in debriefing at, maybe just looking at it in the future, because again, it's kind of a disservice to street outreach that they're able to get a much better count than we're able to get on pit count. And this is not a problem that's isolated to Durham. It's in a lot of places, but I think that we're in a unique position to have the level of cooperation we have, and to have the pit count conducted by the same agency that does street outreach. I think we want to support them in the best way possible to make sure that their efforts are reflected on the pit count as they are through the course of the year. So again, I want to table it here, but in debriefing, if we could have some discussions regarding that.
And just really quickly, I think this year, because we also are very aware of that, and in the past years too that I've been here anyway, I've only coordinated the pit count twice because Housing for New Hope has been responsible for that twice. We have been very thoughtful in that process, because I also worked in Raleigh and I coordinated pit count there, and we did not use officers, correct?
Right.
But here, I think this year we focused on using heart because they're more, and they have the kind of team approach as opposed to use officers. So we used heart as much as we could to accompany those. And then we have such a there's a crisis out here on the use of illegal substances, and so it is concerning sometimes going and not having a direct connect or someone to support in the event that we come into an issue. But I think this year we specifically wanted to use less officers for that reason and use more heart staff as opposed to what we've done historically. So hopefully we can continue that, but I just wanted to make that point before we moved on.
Okay.
Thank you so
Thank,
much.
yeah, thank you all and I'm gonna let Anthony Henderson, he has his hand up, contribute to the discussion, but I appreciate you all putting some context around this in terms of the accuracy of, and also the optics of what it looks like in the safety, because I'm sure there's a balancing act with all of that. You're wanting to do an accurate count, but you're also not wanting to intimidate people through law enforcement as well. So I think this is a good discussion to have, not only in this group, but also maybe, like as Lloyd suggested, policy and procedures, because this has been a part of the process, I think, for quite some. Let me ask one question, then I'm going to yield to Anthony. Are the officers in uniform, or are they plain clothes?
They have been in uniform. Mm-hmm.
Okay. All right. Anthony.
Thank you, Tracy. And I want to make sure Renee has her hand up too. Hers might have been up before mine. Okay. but I'll go ahead and just recount. I'm gonna try to recount it real fast, my experience, because this was my first pit count ever. There were 3 people on our counting team. We had 4 locations to go to, and then of course at each of those locations we would wander about the area. Um, um, and I have to give kudos. The planning team did an amazing job. So let me start there. I think though from a volunteer experience of doing the count, the officer that accompanied us was a narc officer and had to not only be in uniform, but masked so that his face could not be shown. So you really could only see his eyes the entire time. Like not even we saw his face. And it was interesting because his police car followed us everywhere as we went, even when we moved from one side of a parking lot to another side, or from the front of the building to the back of the building. He followed us everywhere. So it was really interesting because although we were out at the count for a couple of hours, we didn't count anyone, because people were not there. Think there's a lot that goes into that. So, and Shantae, by no means is this any kind of criticism, of the planning, because I don't know that we could have planned it any better in terms of the logistics, but it was interesting having the experience of going out for the first time. And then right at the end, to when we realized we weren't going to find anybody, talk to anybody, and we were at the end of our 4th location, we started talking to the officer. And at some point where we were, um, there was some kind of call on the radio, and a couple of police cars zoomed by, and he turned his radio on and he said, "Thank you all, I've got to go." And he literally ran to his car, sped off, like burning rubber, sped off, right, with lights flashing and stuff like that all of a sudden. So it really ended up being more like a first 48 sort of experience. Like, somebody takes you into the hood of Durham, right, and kind of leaves you there and speeds off with police lights and stuff. Um, and it wasn't until the officer sped off that someone actually came from somewhere. We don't know where he came from. And he said, "Are you all okay?" But while the officer was there, he did not come anywhere near us. But as soon as the officer pulled off, he said, "Are y'all okay?" And we said, "Yeah, we're doing fine. We're getting ready to go." And he said, "Okay, I'm just checking. So it was a really interesting first outing, quite unsettling in some ways. And so I just wanted to share that. Thank you for allowing me to share that experience.
Thank you for sure.
That's really good feedback.
Yeah,
I think that's very interesting.
I'm a
I
fan of
also,
48 hours, so that was
yeah.
a good kind of connection for me. No, I'm just kidding. At any rate, Miss Renee.
Well, now that we have an opportunity to share, we had a NARC officer as well. He followed us in a regular car. So from our perspective, it worked out fine. We did have 5 locations to go to, and we found people were engaging in a few of those locations. We found one gentleman that was allowed to build one of those Home Depot type buildings, and he was actually living in it on the property for which he worked. And there were 2 other people that were really wanted help. And so I think from our perspective, the officer being there because he was in an unmarked car, he did have his uniform, he had the flashlight to really help us see that kind of thing, but he kind of hung back. So we were able, I was the team lead, so we were able to engage people to talk with them. But then on my team, a lot of us have been doing this kind of work anyway through other organizations. I do think we do need to look at the policies again, and maybe if we're able to have security, to have, to look at how we are being secured, because I think an unmarked car makes a big difference. And also, for them to allow the team to take the lead. We did find some encampment areas where people did not want to, where they actually had built shelter. They did not come out, but other places we were able to get good information. And that's why I was concerned about how they would be followed up on. So I think that the time, the fact that the weather was warmer might have had an impact. Also, we had previously really cold weather. So if anyone knew family, they probably were able to go to family, and maybe they were not on the streets in the numbers that we expected. So I thought it was overall a greatly organized. Shantae, your group did a great job. I thought the policies were in place to allow everyone that is interested in this area to be engaged. Having the politicians there, I thought that was helpful. It helps to spread information to the community. And so I thought it was a good experience.
Okay, thank you for that. Given where we are with time, and we've got two more agenda items, we've got to vote on the minutes, but we also have the semi-annual performance evaluation. I'm going to go ahead and move us there, but I think this is good information, Lord. As you said, you all will probably do a debriefing once the numbers are calculated and you kind of, better understand all the events and everything that took place. This may be also a good opportunity to bring people in who had that first time experience, if not volunteers, to kind of give you all some feedback as well. There's always room for improvement with any process, and there's no perfect process in any given community, but you also want to, I think we all strive to at least count people and see if we can have the most accurate count given that glimpse or snapshot of one night. So thank you all for your feedback and also your experiences in being involved with that, and Lord, with the city of Durham and Housing for New Hope leading the charge with that. So I'm going to move on to the next agenda item, the semi-annual performance evaluation for 2024, and I'm going to yield to Lloyd.
Thank you, Madam Chair. We have been trying to work with our partners at the HMIS lead agency. The North Carolina Coalition on Homelessness is our HMIS lead agency managing our HMIS implementation. And one of the things we've been looking at with them over the last couple of months is whether there's ways we could develop a custom report in the HMIS itself that would provide much of the data that we have been completing for several years using an Excel spreadsheet primarily. Obviously, the committee members may recall that the performance evaluation tool changes slightly from year to year depending on our experience with the previous year's tool. This year, a big change was we removed the Housing First evaluation portion of the tool from our actual scoring instrument as well. We don't yet have an HMIS report that will provide the information to us that we need to compile the overall scores on the 2024 performance evaluation tool. We've given the NCCH until the next week, the 16th, I think, to let us know whether they're going to be able to have a report using the HMIS by the end of February. If they can't confirm to us that they're going to have a report available to us to use by the end of February, we'll go back to using the Excel spreadsheet that we've used for the last several years. The advantage, obviously, of using the HMIS is that it would automate a lot of the reporting and the calculations and make it easier, and we would need less staff time. to complete the evaluations. But once we know where we are with that, we'll be able to move forward one way or the other on working on the performance evaluation of our COC projects. We are committed to getting the performance evaluation of our COC projects completed by mid-April. So we're on schedule to get that done one way or the other.
Okay, thank you for that, Lloyd. Just a quick question for clarification. And I remember you bringing this up at the last meeting. The customized report that we're trying to have for the COC, for Durham COC, it would be in a different format than what you've used in the past. Is that what you're saying? And not include one data point around the housing first, or would it include the housing first data point?
Okay, so it would not include the housing first evaluation that we're doing with the teams that we referred to earlier.
Okay.
The performance evaluation tool, I don't know if people need me to share it. I would need a moment to find it, but much of the performance evaluation tool that this committee approved, I think back in November or December, focuses on information that is in the project's annual performance report, but it takes that information, for example, it will calculates the percentage of people that have improved employment income, for example, or maintained employment income, right? So to develop that percentage, one needs to know not only the number of people who have maintained or improved employment income, but the number of people who are, the number of adults who are in that project, right? The annual performance report doesn't provide those percentages, but it simply gives you the numbers. And so what we've done is developed an Excel spreadsheet where we would need to go to the APR, find the number, and then input it into the Excel spreadsheet. The report that we are hoping the HMIS custom report, they are working with a consultant to develop a custom report. The custom report would put those numbers and the percentage into a report for us so that we could simply find that percentage without having to input it into an Excel spreadsheet.
Okay, so the customized report would extrapolate all that data for the city of Durham to be able to have their
Correct.
report based on versus you going and calculating that per program or project.
Correct. Right.
Okay, I
get
get it.
It would still provide the information per project, but it would do the calculations for us, presented in a report, and not require us to find the information in the APR, input it into an Excel spreadsheet, and then do the calculation in the Excel spreadsheet. It would do the calculations for us from the data in the HMIS.
Okay, so it kind of simplify your process on the back end with this. Okay,
it would save us time.
I understand. Any questions from the group regarding the information that Lloyd shared regarding the evaluation, performance evaluation? Okay. All right, seeing none, we're at 11:21. We're gonna go back to revisit item number 3 on our agenda, which is the approval of the January 2024 minutes. And I think Shanta, you said you had sent those out, right? So
yes, Melissa sent those out at the top of the meeting.
okay.
I do know, like I said, the only thing that I know for sure needs to be changed is the date at the top.
Okay. All right. Noting that edit to the minutes, are we ready to, 'cause we do have quorum, don't we? I think we do. I think Melissa said at one point we had quorum. Do we have quorum, Melissa?
We did have quorum at the beginning of the meeting, and quorum stands once it's been established. So as long as we have 4 votes, yes, then we should be fine.
Okay. What'd you say, Lloyd?
I'm sorry, should have muted. I'm good.
Okay. All right. So at this point, we will receive a, if someone would like to, make a motion to accept the minutes with the edits that's been, cited.
Good
So
morning
moved,
again.
Madam Chair.
I'm sorry.
Go ahead.
I know Mr. Renee started, and then I saw
Yes, I was,
Vegas and Ms. Angela.
I was just gonna say, so moved, Madam Chair, as you stated.
Okay. All right. Thank you, Ms. Renee. Can we get a second?
Good morning again. This is Vega Swepson, and I'd like to second that, please.
Okay, thank you, Ms. Vega. All right, the minutes have been approved with the edits. If you can put in the chat to vote on the minutes. Okay, all right. Thank you for those of you who voted. It has been approved with the edits that Ms. Addison cited earlier. And so that brings us to the end of our agenda for our meeting. Thank you all so much for the discussion and Lloyd for the information presented today in terms of our moving forward around the performance evaluations, PIP plan, Housing First, and also the 2024 semi-annual performance evaluation. We will look to have those minutes out shortly with Ms. Addison sending those out for this meeting for February the 8th for preparation for our March minutes. And so if there aren't any other questions or comments at this time, I'd like to entertain a motion to adjourn. Give you back 5 more minutes of your time today.
I'll make a motion to adjourn.
All right. Thank you, Ms. Angela.
I will
Can I get
second.
Okay, thank you. I was thinking you all wanted at least 5 minutes of your time back. So thank you all. Thank you, Lord. And thank you, Jonathan, for giving me an opportunity to kind of help him out as he was had a scheduling conflict today. So and I'm also going to throw it out if anyone else would like to help Jonathan in chairing the the subcommittee meeting to facilitate that discussion. I will gladly share that with Jonathan so we can share the love with chairing this committee. But thank you all for your time and information, and we'll see you at the next meeting. Have a good day. Take care.
Next time, everybody.
Thank you. Great job.
Bye-bye. Thank you. Bye-bye.